is very low,
Yeah.
and which activities like mass gatherings may be, in a certain sense, more optional. And so until you're widely vaccinated, those may not come back at all. But with the economy, we can bring it back. There will be a point where we have the vaccine and we're going completely back to normal. We're working closely with the vaccine companies, and they're the ones, although it's probably 18 months or so, they're the ones that can really get things back to where we're not worried about large public gatherings. It will need to be, certainly tens of billions of dollars put into this readiness, these germ games like war games that will really test out our systems and make sure that we move faster than the virus does.
Have you talked with the president about this?
I've not talked directly to the president. Our foundation is trying to be as helpful in a very constructive way as possible, and that's why I've talked to the head of the pharmaceutical companies. We've talked to a lot of the agencies, including CDC and NIH, about how we work together on the vaccine and the drugs. But the idea of big public gatherings, I do believe once we have the vaccination, then the kind of fears and the change of behavior around that, it could definitely be pretty close to where it was before this started. Mm-hmm. Awareness of this is a threat, and probably the biggest threat to kill tens of millions of people. That will be permanently embedded. I find it so disconcerting to wake up every morning and think, well, that was a strange dream I had, and then say, oh my God, yes, look, there's no traffic on the bridge, and oh yeah, my first meeting is on that computer screen, and my second meeting's on that computer screen, and and somebody's going to leave some food, but I won't see them. This is super dramatic.
Earlier today, we released our modeling on how we think this pandemic might unfold. The modeling shows that COVID-19 arrived in Canada later than in other countries. So we're in an earlier stage of the outbreak. That means we have the chance to determine what our country looks like in the weeks and months to come. Our healthcare systems across the country are coping for the time being. But we're at a fork in the road between the best and the worst possible outcomes. The best possible outcome is no easy path for any of us. The initial peak, the top of the curve, may be in late spring with the end of the first wave in the summer. As Dr. Tam explained, there will likely be smaller outbreaks for a number of months after that. This will be the new normal until a vaccine is developed.
If there are going to be multiple waves of this, if we aren't going to be able to sort of get out of this until we find a vaccine, which we're told is 12 to 18 months away at best, do you envision that we're going to have multiple waves of shutdowns, lockdowns, closures of the economy? And how can we handle those kinds of constant shutdowns?
I think even after we're through this first wave, we will need to remain vigilant, and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this. And as you say, that could be a very long way off. But once we get through this first wave, we will have developed both tools and habits that will allow us to be much more resilient and resistant to further outbreaks and spreads, that will be able to be kept localized, that will be able to fight against and protect our most vulnerable from over the coming months. It will require continued actions in different places and quick responses. But part of getting through this wave in a rapid way will be because we are developing the tools that will also help us when those wavelets come forward in the coming years.
Did you hear that, ladies and gentlemen? Trudeau is going to hold us hostage, imprisoned in our homes until Bill Gates, the son of Lucifer, develops and delivers his vaccine, his poisonous vaccine, to Canadians.